Welcome back to Hardball. It was a day of political theater on Capitol Hill as House Republicans pushed a vote to repeal the Affordable Care Act. Not surprisingly, it passed 244 to 185. What does that mean exactly? Not much. The bill is certain to die in the Senate. So you might be curious, what was the purpose of calling the vote in the first place? It's a good question. It wasn't the first time Republicans pushed a symbolic vote against health care. In fact, this was the 33rd time the House has voted on repealing all or part of the president's health care law. What exactly was the point of today's political stunt? Congressman Steve Israel is the chairman of the Democratic Congressional Campaign Committee. Congressman, 33 times? How come?
Because they will do everything they can, as many times as they can, for as long as they have the majority, to protect insurance company profits instead of strengthening the middle class. They began their majority in January of 2011 by voting for a Ryan budget that took Medicare away from senior citizens. They will end their majority by voting endlessly to repeal patient protections for the middle class. That's what they do here. That's what they care about.
All the Republicans lined up. You had 5 break ranks. Why 5?
Well, look, we have a diverse caucus, and we have members of Congress in our caucus who represent conservative districts and progressive districts. I don't think we should be held accountable for 5 Democrats who voted differently. I think the Republican majority should be held accountable for the fact that every single one of them voted in lockstep with the big insurance companies to protect those insurance company profits and instead tell middle-class constituents that all the protections that they have now have been taken away. If you're a woman with breast cancer, today the Republicans voted to take away the protection from an insurance company saying it's a pre-existing condition.
Congressman, I'm sorry, would you allow me to show you something that Eleanor Clift wrote in a column for the Daily Beast today? Quote, a do-over is rare in politics, and the Supreme Court handed one to President Obama by upholding his much-maligned health care law. Backers of the president and the health care reform that he pushed through and which cost Democrats the House would like the administration and its campaign allies to move more aggressively and take advantage of the judicial thumbs up. Why has the Obama team shied away from bringing the law into sharper focus now that it's been ruled constitutional? You know the issue. There's a perception that no Ds are out there selling it. I hear from my friends at Kantar Media that all across the country, Republican congressional candidates are beating the hell out of the health care bill, and there's not a response from their Democratic opponents.
Well, I respectfully disagree. In fact, I was at the White House today for a meeting with the president and the House Democratic leadership, and we talked specifically about the fact that the American people and the middle class support this bill. In fact, I can just give you some recent polling. The Washington Post did a poll today. Only 1/3 of the American people support a full repeal of the bill. And as the chairman of the Democratic Congressional Campaign Committee, I've been very outspoken in advising our candidates not to run away from the patient protections, but instead to talk about how important they are to growing and strengthening.
But respectfully, I would say you're the exception. I think you're the exception to the rule, because I just don't hear. And I for a living, I take phone calls from all across the country, and I hear from people who say that the Democratic candidate is running from it, even if they voted for it. And I think the price you pay is all of the misinformation. PolitiFact lie of the year that this is all a takeover of health care. But that permeates if it's not responded to.
Here's what we learned from 2010, that the more people know about these patient protections, the more popular the patient protections are. We learned that in 2010. We are articulating it in 2012. And I have said to all of our candidates, if you think the strategy to winning an election is to defend or to run away from this, that strategy in 2010 didn't work. The strategy is we should be running on it, because as people know more about it, it becomes more popular. And today's Washington Post poll is proof of that.
Thank you, Congressman Steve Israel.
Thank you.
Republicans and Democrats spent hours today debating the merits of the president's health care law. Here was Speaker of the House John Boehner and Minority Leader Nancy Pelosi.
There's a better way, and that's why we're here today. Americans want a step-by-step approach that protects the access to care that they need from the doctor they choose at a lower cost. They certainly didn't ask for this government takeover of their health care system that's put us in this mess that we're in today.
American people want us to create jobs. That's what we should be using this time on the floor for, not on this useless bill to nowhere that does serious damage to the health and economic well-being of America's families.
So that's what went on today on the floor of the House, where this overwhelming vote was taken without a surprise ending. It will now go to the Senate, perhaps, and there it will die a slow death. We're joined now by Congressman Steve Scalise, a Louisiana Republican. Congressman, I believe in accountability, but 33 times? How come? Congressman, can you hear me now? We're having some trouble, obviously, with Congressman Steve Scalise. The question that I want to ask of the congressman is why this would necessitate 33 different votes. As we showed earlier, Mitt Romney was booed today at the NAACP conference when he talked about getting rid of Obamacare.
I'm going to eliminate every non-essential, expensive program I can find. That includes Obamacare, and I'm going to work to reform and save.
Congressman Scalise, I think we've got you now. Why, sir, does this necessitate 33 votes? Don't you think folks already got the message as to how the House feels?
Well, look, first of all, this is the first time since the Supreme Court made their decision that confirmed that it's a massive tax increase that we've had a chance to go back and say, let's have another opportunity to repeal Obamacare. Now, look, it's been over 30 months since the Senate has passed a budget. That doesn't mean we stop doing our job in the House and passing a budget. By the same token, if you look at this bill, Nancy Pelosi famously said you've got to pass it to find out what's in it. Well, the American people don't like Nancy Pelosi and Barack Obama's vision of a government-run health care system. We want to give people the chance to repeal this, start over, and actually fix the problems in health care instead of the massive tax increases on middle-class families in this bill, as well as the increased health care costs and the government coming between doctors and patients.
And what alternative is the Republican Party now putting forth, having achieved this 33rd vote on rejecting Obamacare?
We've got a series of things that we've put forward to reform health care and actually lower the cost. One thing we passed just a few weeks ago was a major medical liability reform bill that will save $100 billion in Medicare and in health care overall and actually lower the cost of health care. In addition to that, of course, Obamacare takes $500 billion out of Medicare, which has expedited the bankruptcy of Medicare. And so we've taken steps to shore up Medicare and make sure it doesn't go bankrupt. We've passed a number of bills, and we're ready to go with even more once we get repealed.
Is there anything that will be introduced and voted on between now and November that would take care of the 30 million who are uninsured, will be insured according to the Affordable Care Act in the event there is a replacement scenario?
Right. Well, outside groups have already confirmed that millions of Americans will lose the health care they have that they like under Obamacare. So what we've done is passed measures, and we're going to continue to bring this up, pass measures that will actually increase access and lower costs for not only the millions of Americans that are uninsured, but the millions of Americans that have health care today that they like, that health care is jeopardized by Obamacare. And that's not just from outside groups. We're already seeing small businesses saying they can't comply with this law. 75% of businesses that have looked at the law said, we don't know how we can keep providing health care for our employees that they like.
I know I know, sir, that if Chris were here, he'd be saying something like there were 8 years on President Bush's watch and 12 years before Clinton where the Republican Party, didn't put forth a health plan. Is anything going to change if you get your wish?
Well, I'm not sure what Chris would have said, but I know I wasn't there when that happened. I know what we're trying to do right now. We brought bills forward, and I've co-sponsored many that will lower the cost of health care, fix the real problems, like making sure that people with a pre-existing condition aren't discriminated against. But you also have to make sure you're not gutting Medicare with the $500 billion in cuts that the president has in his bill and the hundreds of billions of dollars in new taxes on middle-class families that broke the president's own pledge, where he said he wouldn't raise taxes on middle-class families. He did it under Obamacare. We're trying to set the record straight, repeal this, and start over and fix the real problems.
Thank you, Congressman Steve Scalise.
Thanks, Michael.